Hello, I'm Harold Munro, Editor-in-Chief of the Vancouver Sun and Province, and joined by our legislative reporter, Katie De Rosa in Victoria. Hi, Katie.
Hi, Harold. Good morning.
You had a busy Monday. We're now doing this on Tuesday instead of Monday, but George Heyman announced that he won't be seeking re-election for the NDP in Vancouver. Was that a surprise?
I think it was a surprise, especially because obviously the NDP is doing well in the polls, so it
Right.
seemed like anyone who's a minister now might want to throw their name in again. But he did mention he's 75, and yeah, it sounds like he's sort of felt like he wants to pass the torch to some younger member of caucus who has the opportunity, and he quickly threw his support behind Andrea Reimer. She's a former three-term Vancouver City Councillor, a professor, and quite an interesting story. I talked to her yesterday. She had time in her life in her youth where she grew up on the street. She was adopted at 6 months old, and discovered her Indigenous heritage in her adult life. And so Heyman was quick to endorse Andrea Reimer, but shortly after his announcement, current Vancouver City Councillor Christine Boyle came out and said she is also contesting the nomination in the so the new riding is called Vancouver Little Mountain, previously Vancouver Fairview. So that is a sort of rejigged, recarved riding that will take some of the majority of the former Vancouver Fairview. So yeah, it's going to be an interesting contest between a former Vancouver councillor and a current city councillor.
Mm. And a very strong NDP seat in any election, but certainly with where the NDP are in the polls these days, I would imagine a much sought after nomination. So that I guess explains why we've got two pretty big candidates going for that one.
Yeah, and I asked, Christine Boyle. I said, you have a lot of values in common with Andrea. Both champions of affordable housing, climate, and sustainability. And she, Christine said, it's actually, yeah, I feel it's unfortunate that we're running against each other instead of in different ridings, because I think they
Mhm.
would be very strong candidates with a pretty high profile. Christine said she thought it was unusual that George Heyman threw his support behind Andrea. So obviously she was not so happy about that. She considers Premier Eby a close personal friend, so I suppose that was a bit of a sting. And I did ask her, is that going to hamper your chances? And she said no. The minister is not the only one voting, and she believes that she can get the support of NDP members. And I asked Andrea as well about the contest between the two of them, and she said it's a sign of a healthy party that there's two strong candidates contesting the nomination.
Right. So it's a fairly quick turnaround. It's really only a month from now, and they'll be
Yeah,
voting.
yeah. The nomination vote is early April, so that is a pretty quick timeline. So not a lot of time to sort of drum up support. And again, Andrea seems to have a bit of a head start in terms of that endorsement from Heyman. So it'll be interesting. I think the two of them don't want it to be a bitter fight. Obviously, when you're running against a fellow NDP member, you don't want to give your opponents for the election sort of fodder for criticism. So yeah, it'll be interesting to see how that shakes out.
Right. Right. Are you aware of, are there any other Vancouver seats that might come open where one of them, whoever doesn't get this nomination, might be able to land?
Well, we're waiting to hear for the who's going to be nominated for or the candidates for Vancouver South Granville, but I'm hearing that there's people in mind for that, so that didn't seem to be an option for either
Okay.
Andrea or Christine.
Okay. Interesting. Any other we had the high profile departure or announced departure of Mike de Jong recently on the BC United side. Uh, any other New Democrats that are contemplating at this point? Are you hearing about?
We know, Selena Robinson is not running again. She said she had already made that decision before she resigned her position from as post-secondary minister. We haven't heard yet from Harry Baines or Bruce Ralston, who are again some of the older members
Hmm.
of the NDP caucus. Mike Farnworth, public safety minister, is running again. So yeah, I think, and we know Nicholas Simons as well is not running. So we're starting to hear the news trickle out, but
Right.
yeah, it sounds like the younger members are pretty pretty gung ho to run again, because if they're confident in their chances, then they're going to want sort of a plum position. So I think it's some of the veteran NDP caucus members that were are big question marks.
Right. Well, that's interesting. Baines and Ralston, of course, are both from Surrey, both cabinet ministers. So those would also be, I would think, highly contested nomination meetings should one of them decide to go.
Yeah, yeah. So it'll be interesting to
Fun.
see how it shapes
It's
up.
yeah, lots to sort out between now and the October election for sure. So we'll keep an eye on that. Last week, Katie, you were writing about the province's recruitment efforts in the UK, trying to bring doctors here. Tell us more about that.
Yeah, well, the government has always recruited internationally, but the difference here is that in the UK, doctors with the National Health Service are striking. They're going on rotating strikes to protest their low pay and what they say are poor working conditions. So if you look at what the new negotiated contract with BC doctors, they're getting paid in the 300,000s, which is about double what a NHS doctor would make. Of course, the BC doctors, the wages that they make, they have to subtract their overhead and their wages for their staff. So that's not their take home. But the BC government is saying that those new negotiated wages are among the highest in the country for family doctors. However, the roadblock is still that international doctors really face challenges in actually getting their work permits, like getting residency spaces. So actually becoming a doctor here is a lot harder than the government is making it out. I talked to a physician recruiter named Phil Martin, and he said that it takes maybe a year to a year and a half for a doctor to from the time they leave their practice to start working here in BC. If you are a doctor a medical graduate who goes to medical school internationally, there's a limited number of residency spots in BC for international graduates. So that's a limiting factor. And then there's another program. Basically, you can become an associate physician. So you would have to work under a BC doctor for a certain period of time, which, if you're a doctor from another country, you might feel a bit
Right.
put out by. You might feel like you have more experience in that. So I really think that even though the government made a big announcement in November about decreasing the road or removing some of the red tape, I still think the red tape is there. And again, this recruiter I talked to, he said BC is the worst in Canada, and Canada is one of the hardest countries in the world in the Western world to immigrate as a doctor. So we are by no means ahead of the pack on this one.
So what does the health minister, what does Adrian Dix say about that? Like, is that not an obvious impediment that he would like to see removed?
I mean, I asked him that, and it sounds like he said he touted the changes that were made, but again, the number of practice ready assessment spaces, which is the certification program you have to go through as an international doctor, he said they tripled, but they tripled from 32 spaces to 96. And so 96 is obviously still a small number of doctors every year that can come and have their qualifications recognized. So I asked the question, and the government says they're working on it. But I think, for example, BC United was really critical, saying we need to make it easier for international doctors to work here if we are facing such a shortage. And the government has also touted the number. We've had 700 new family doctors join the ranks, either perhaps they were working as hospitalists and they came over to family practice. They said that's in the last year. And I think many are saying, where are these doctors? Because we still can't get one.
Right, because you'd think then that the number of people without family doctors, that list should be shrinking, but it's not shrinking in any sort of significant way at this point.
Well, I think it would be interesting that the health ministry keeps saying that they're going to give us an update on the registry that they created, the
Oh,
family
yes,
doctor
yeah.
registry. My colleague Tiffany wrote about that there's some doctors are concerned the registry is not even working because they're still getting calls from people saying, I want to be matched with a family doctor. I've been on the wait list for years. Last week, I also talked to the family of the Nanaimo girl, a 23-year-old Nanaimo woman named Sophia. her and her family, they were on that wait list for a family doctor for 3 years, and she could not see a family doctor, and she had medical complications and infection, was taken to hospital, kept getting misdiagnosed, and she ended up dying of an infection. So
Terrible
that
story. Yeah.
that was
Yeah.
a really, really tragic story. And again, that has been brought up repeatedly in question period by both BC Conservatives and BC United as an example of the family doctor crisis. So I think there's a lot of questions around this registry and whether people are getting placed. Where are these 700 new family doctors? Is there a breakdown of geographical locations and how many new patients have they taken on? I think there's a lot of data that we need to find out in terms of assessing where we're at in the family doctor
Right.
shortage.
And I know you've been asking for that data and they've been promising it, so we'll just keep asking, I guess, until
Yes, we
until
will
they
keep
hand it
asking.
over.
Well,
All
I
right.
think question period is about to start. So
Okay.
yeah,
I'll let you
we'll
go
wrap it
then.
up.
Thank you, Katie.
Thanks, Harold.